This video was made to empower you with an acupressure routine you can use in yourself for well-being. Acupressure has been shown to improve quality of life. You're invited to follow along with the tutorial as we demonstrate the technique for 5 acupressure points for well-being.
This acupressure routine may not be appropriate for some people, including those who have brand new symptoms or who are pregnant. If you experience any discomfort, dizziness, or other unusual symptoms, stop the acupressure immediately. If these symptoms do not go away, contact your healthcare professional. Do not use acupressure over areas where you have a wound, severe swelling or lump, active infection, recent blood clots, rash, or areas that are very numb. However, you may be able to use other points away from those affected areas. If you take medications to thin your blood or have a bleeding or clotting disorder, use only light pressure. This routine is not intended to replace standard medical treatments.
Acupressure is thousands of years old and likely existed before acupuncture. This simple routine can be easily learned and used in your daily life. To get started, it is best to sit or lie down in a comfortable position while applying acupressure. You may need to bend and stretch to reach the points, so loose clothing may make that easier. Accessing the points with contact on bare skin is best. Try minimizing distractions such as silencing your cell phone or turning off the TV. Consider playing relaxing music in the background that is enjoyable. When you first learn the routine, you may follow along with a video and take your time finding each point. As you practice more, you will find that locating the points becomes easier and the routine may become automatic as you remember the points in order. Once you are familiar with the routine, you can also try doing it on the go. I invite you to follow along on yourself as we demonstrate each point. To perform the acupressure routine, you will press or massage the points for about 30 seconds each. Use the amount of pressure that feels comfortable to you, enough pressure to feel some sensation. If painful, just use less pressure. Sometimes a light touch is all that's needed. Remember, if there are any locations that are uncomfortable, or if you have a wound or swelling in the area, just skip that point and use the others in the routine.
The first 2 points in this routine are found on the lower leg below the knee. It will be easier to find these points when there's no clothing in the way. Try wearing loose-fitting clothing that can be rolled or easily moved out of the way. The first point, ST36, is located below the knee, just on the outside of the shin bone, 1 hand width down from the knee. There are different ways to reach this point. For example, while seated with your feet on the floor, try leaning forward and placing your hands on the sides of your legs. You can also try crossing your leg over the opposite knee like this. Or try placing your foot on the seat of the chair. If it's not easy to reach this point on yourself, skip it and move on to the next point in the routine. Once you have found a comfortable way to reach this point, press and hold this point for 30 seconds, or you may massage this point using small circles for 30 seconds. These points should be done on both sides of the body. In this video, we are only going to show you how to do the point on one side. While watching the video, if you would like to do acupressure on the same point on your other side, pause the video and resume the video when done. The next acupressure point is called SP6 and is found on the inside of your ankle. Like the last point, there are several ways to reach this point. You can cross your ankle over your opposite knee if you're sitting in a chair. If this is uncomfortable for you to do, bend forward at the waist to reach down towards your ankle, or bring the foot close to you by propping it up on a chair in front of you. If these options don't work for you, try asking a caregiver to massage or press this point for you instead. To find this point, start at the bone that sticks out at the inside of the ankle. Place the edge of your hand on the high point of the ankle bone. Use your hand to measure from the ankle bone up your leg, staying in the soft part behind the shin bone. This point is located where the hand ends. Press and hold or massage this point for 30 seconds, or you can try pressing and releasing for 30 seconds. Use the technique that feels best to you. Feel free to pause this video to switch to the other side and press for 30 seconds. LI4. The next point, LI4, is found on the back of the hand between the thumb and first finger in the web space. This point is best activated by pinching the area with the opposite thumb and first finger, like this. We are going to work this point for 30 seconds. You can try pressing and holding, or you can try rubbing using small circles. Use the amount of pressure that feels comfortable. The amount of pressure that is comfortable can be different for each person and may vary at different times of the day. Remember to do both sides. LI11. To find the next acupressure point, LI11, bend your elbow to form a 90-degree angle and rest the arm across your body, or try holding your elbow in your opposite hand. Notice there is a crease formed when the elbow is bent in this position. With your thumb, press the area halfway between the end of the crease and the bone like this. Try pressing and holding first, then try rhythmic pressing and releasing a few times. Use the technique that feels better to you and continue for 30 seconds, then pause the video to repeat on the other side for 30 seconds. You may find at some points it feels better to press and release or to rub in circles. You do not need to use the same technique on each point. Just do what feels best to you at each site. LU7. Our last point in this series, called LU7, is found on the thumb side of the wrist. To locate this point, open both your hands, then bring them together, joining the web space between the thumbs and index fingers like this. Then reach past your wrist with your opposite index finger, staying in line with your arm. Make sure you are on the edge of arm bone past the wrist by 1 to 2 inches. Try pressing with light to moderate pressure and hold for 30 seconds. While holding any of these points, try breathing deeply into your belly and exhale with a long, slow breath out. To do the other side, reverse your hand positions, find the point, and then press and hold for another 30 seconds.
This acupressure routine may be done many times a day for your well-being. Please continue to pay attention to your body and do only what feels right to you. If you find any points to be uncomfortable or hard to reach, just skip those points and focus on the others. If you have any new or unusual symptoms, seek medical attention. To download a handout with pictures of the acupressure points to use as a reference, please follow the link below the video found in the description.